Today, I'm going to walk through AgeView's new HIV Impact Calculator. This is an interactive decision tool that lets you, as a policymaker, a public health professional, or an advocate, get an idea of how changes in PrEP coverage or viral suppression might influence future new HIV infections and costs over time. This is a tool that was launched in October 2025 by AgeView and Emory collaborators. So the purpose of this tool is to help make visible the trade-offs in investments in prevention. And the tool is going to let you ask some what-if scenarios about PrEP coverage and viral suppression. And it's going to show you results immediately and let you share the outputs. You can use it for advocacy, for planning, for budget discussions. And so we hope it's a good source of information for you. So let's go to the calculator. If you land on the AgeView home screen, you'll just go to Tools and Resources. We're going to go to the Data Incubator, and there's a nice purple icon here for the HIV Impact Calculator. Really, this is going to start out with an understanding of where we are in the epidemic, which is about 32,000 new infections per year. About 2/3 of people living with HIV have viral suppression, and we're only about 1/3 of the way towards our goals for PrEP coverage in the US. So if we scroll down a little bit, this is where you're going to make some choices about, what kind of scenarios you want to see. So let's just think about a scenario where we want to estimate what would happen if PrEP coverage reduces by 10% over the next decade. So that's going to take us into the red here. We'll just slide over to a 10% yearly reduction in PrEP coverage. And we can see that the impact of that would be about 2,600 preventable HIV infections, and over a decade, nearly 27,000 preventable HIV infections with a lifetime medical cost of $11.3 billion. And, why are we sort of asking these kinds of questions now? Whenever there's a discussion about health policy and funding for HIV prevention, we really have to ask what the consequences of that might be. And it's important to say that we also should think about what's possible, meaning we also should be asking questions about how many infections could we prevent if additional investments are made in PrEP coverage. So by increasing PrEP coverage by 5% per year in state and federal budgets, that would prevent an extra 1,275 infections per year, over 12,750 over a decade, and save $5.4 billion in medical costs for HIV treatment. You can really grab these numbers and associate them with some different levels of increases or decreases in PrEP coverage to have that discussion for budget planning. Every output that we present here is meant to be something that you can actually use. How many extra infections, how much additional cost, what's the gap relative to our policy goals for ending the HIV epidemic in the US? And you can use these numbers in reports, in having discussions with policymakers, advocacy memos. And so we hope that you'll find that the HIV Impact Calculator is a powerful tool to bridge the sort of modeling studies that go on and are reported in scientific papers and the real world decision making that's going on right now about how we're going to plan resources to try to help end the HIV epidemic. This should let you help translate changes in the coverage of treatment and viral suppression, as well as prevention, to public health policymakers and understand the financial consequences. So if you're working in public health, in advocacy, or in government planning, I encourage you to try it out. You can explore as many scenarios as you want and bring back the insights of those into your strategy discussions. Thanks for watching, and visit ageview.org to get started.